This is Wellspring, presented by Spectrum Health Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, July 1st, we welcome via the Zoom connection, Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome to Wellspring, a live broadcast sponsored by Spectrum Health Zeeland Community Hospital. Zeeland Community Hospital's collaborative School Blue Envelope Suicide Prevention Program with area schools was named a 2021 Ludwig Community Benefit Award recipient by the Michigan Hospital Association last week. And as Gary said, joining me via Zoom this morning is Community Program Specialist Jodie Reimink, and she will share how this program is saving lives. Good morning, Jodie.
Good morning. How are you?
It's nice to connect with you via this way. So, Jodie, you've been at Zeeland Community Hospital for many years. How many years, and what is your role?
That gives away my age a little bit. I've been here over 25 years and doing various things. As you mentioned, currently I'm a community program specialist, which means I coordinate community programs that benefit the community. Currently, one of which is the School Blue Envelope program.
So Jodie, what do you enjoy about your work?
There's so many things. First of all, I really enjoy the challenge of it. I also really enjoy the wide variety of tasks that I get to do as a part of it, a variety of topics that I've been able to help address. But I think most importantly, I really enjoy giving people tools in order to lead healthier lives.
And one of those tools that you have been really intimately involved is the School Envelope program. So what is the School Blue Envelope program that Spectrum Health developed?
It started in the medical group, and it's really an all hands on deck approach to suicide prevention. Instead of training the so-called experts in the community, they trained everyone in the entire medical group, the receptionists, the nurses, the doctors, the social workers, the custodians even. And the thinking was that everyone has a role in order to help keep patients and their colleagues safe. And so they provided training to all staff and in exactly how to keep them safe. And the SAFE is an acronym for staying with the patient, accessing help, validating their feelings, and eliminating access to lethal means. And so everyone in the entire medical group was trained on how to do those things. It also incorporates 2 evidence-based tools as a part of the process. One is the Columbia Suicide Severity Rating Scale, and that is used to figure out how much a person is in crisis and to get them the appropriate level of help that they need. And then also a safety plan that's also used to help keep them safe. And so I knew about this program in the medical group, but we were also struggling in our community in Zeeland and Ottawa County on how to keep youth safe. And we had seen the data with youth suicides really increasing. And so we wanted to do something to really help keep the youth safe. And so I called my colleague at the medical group and asked her if she'd be willing to partner with us in fine-tuning all of the tools and resources for the medical group program so that they'd be school appropriate. And so that's how it began.
Wow, Jodie, I remember that because, you were having those conversations and you were talking with Jodie with the medical group. So, you had to take the materials because they were, for, the medical group, and you had to adapt those materials for the school. Was that a difficult process, or, were you able to, take them and realize, suicide is very similar? Just talk a little bit about that.
Sure. I would say The tools were basically very similar, but we found that there were some distinct differences between the students at the school and the patients in the medical practices. One of the key differences that we found was that how people find out that someone is in crisis. Oftentimes in a school, they're not with them in person, like they are in the medical group. And so they're finding out about it secondhand through the grapevine or through social media. Someone will post something on Instagram or Facebook, and then somebody else sees it and is concerned. And so we had to figure out in the process, how could schools use that information to get those students the help that they needed? And so that was one thing we really had to hash out. We had a group of professionals from the Ottawa County Health Department, several different school districts, Hope College, Community Mental Health, Be Nice, the Ottawa Area Intermediate School District. They were all involved in helping us make that transition with the materials, and it took almost a year for us to revamp everything and think through the process to make sure that they would work in the school setting. So it was quite a process, and the tools look very similar, but we really had to think through the different things in the schools.
So what has been the response of the schools?
Honestly, we almost can't contain the growth of the program. They have been really enthusiastic supporters of the program. The schools that are participating, actually we did an end of year review with each of them, where we met with each district separately, went over their specific data and talked about how their school did and got feedback and kind of talked through how it went for them. And one of the things that they all shared was that they really appreciated the concrete steps that their school staff had because of the Blue Envelope program. It really eliminated that gray area where they just weren't sure if they were doing the right thing, and they weren't sure if the student was handled appropriately. And now they really felt like this program gave them the confidence that they needed to know that they were serving the student in the best way they possibly could.
Jodie, Gary has a question, but I want to just clarify to people. When you say blue envelope, is it a literal blue envelope?
It actually is. What blue envelope means, though, is it's a code word for I have someone who's in a mental health crisis situation. And so instead of saying, hey, I've got this person here who might kill themselves, it's just a code word for saying, hey, can you hand me a blue envelope? And then because everyone is trained, they understand what that code word means, and they can jump into gear and fulfill their role.
And one question before, Gary, you come in. Let's talk a little bit about the training. What type of training do staff receive?
So there's two levels of training. One is more for the frontline staff people, and that's a 1-hour training. We provide some basic suicide prevention education for them. We also talk about what their role is in the process, and then how they can access the people who can get the students the help that they need. And so really, it's just solidifying their role in the process and how to get the work done. And then there's also a second layer of training that we do that's 2 hours. And there we go into detail with how to keep the students safe more particularly. And then we look at that Columbia Suicide Severity Rating Scale that they use. There's training in that that the school staff receive. And the people that receive that second layer training are more the school administrators, social workers, counselors, and they're the ones who take on that responsibility really of doing the screening and working through with the student through their safety plan, and then making sure that everything's reported and recorded and parents are contacted and that everything is taken care of. So really the training responsibility for them is not that, it isn't that much training for such a significant topic.
Mm-hmm. Go ahead, Gary, with your question.
All right, thank you very much. By the way, we are talking with Jodie Reimink. She is a community program specialist, talking about Spectrum Health Zeeland Community Hospital's collaborative School Blue envelope suicide prevention program. Jodie, what impact has the program been in terms of what has been the impact over the last 15, 16 months because of the COVID-19 outbreak? How has that affected your program, and in what ways?
It's in some ways it's been very difficult, but I think schools are thankful that the program was in place prior to COVID hitting. How we see it is that every Blue Envelope event that happens, it's an opportunity to discuss with a student who's in crisis how we can link them with the help that they need. What we have found is that in the last school year, just in the participating schools in the program, which there's 4 districts in Ottawa County, we had over 380 Blue Envelope events. So that's 380 opportunities really to help kids who are in crisis. And so that's a great thing. And that is with the schools being shut down in November and going virtual. One of the things that we learned was that it is much more difficult to find the students who are in crisis when they're doing virtual school, because the teachers and the staff can't interact with a student like they do when they're in person. So it's much more difficult, and schools actually had to put in place different systems to reach out to those kids who they thought were in crises. Some even went to the students' homes if they were concerned about them, or they would have their security officers check on those students in person. And so schools really did a great job during that, but we know that it was extremely difficult for them to find those kids. And then we also know that the students were more isolated as well because they're not with their peers, and more screen time. And it just seems like those effects kind of snowballed.
Right. And what I hear you saying, Jodie, is when you can see some people can keep up a good face, but, others, nonverbals, facial expressions, lead to, questioning whether someone might be in crisis. But when you talk about 383, when you said that number, even though I heard it, I got chills because I thought, wow, that's a child of a family. You know what I mean? So
Yeah.
Thank you for the program. So, Jodie, there are other suicide prevention programs such as Be Nice, QPR, which stands for question, persuade, and refer, and okay to say. How does the school program work with those?
Yeah, so on our initial planning committee, we had representatives from a lot of those other suicide prevention programs, which really was beneficial and helped us figure out what our niche was and what gap it was that we were trying to address with this program. So they were involved with that. We also like to say it's like a hand in glove relationship. Like they're both separate, but we work together to get the job done. Like they have distinctly different purposes, but both are necessary. And so we found that through our process, we kind of worked out those things. And I would say that all of those other suicide prevention programs are absolutely essential to the success of our program as well. Like if people don't have that base knowledge on what to look for and how to pinpoint kids who are in crisis, it becomes really difficult to find them. And so the more suicide prevention that's out there, really the better.
So last week, the hospital received an award. Tell us about it and how thrilled we were to be recognized by the state.
Yes, it was named after Patrick Ludwig, who championed community health. And so it was a great honor to receive the Ludwig Community Benefit Award. We were one of 3, I believe, winners in the whole state of Michigan. And we are just humbled and honored to receive that award. Along with it comes some recognition, of course, and then a $5,000 cash award that we can use to benefit the program. So yeah, it's great.
Jodie, just want to thank you personally for the work that you have done with this program and the difference that you are making, and the team is making in the community in saving lives. If people want more information about the program, they're listening, what should they do?
They can contact me at Spectrum Health Zeeland Community Hospital. I can give my phone number. It is 616-772-5746, or they can contact the Community Relations Department.
Thank you very much for being here today, Jodie. Until next week, Spectrum Health Zeeland Community Hospital wishes you well.